Hi, my name's Robin Ratcliffe. I'm the periodontist here. Periodontist is someone who deals with gums and gum disease. What I do is I look at our patients, the foundations of their oral health from a point of view of the gums and the bone, and that is the gateway to general health and a lot of other dentistry that goes on. I got my specialist qualification in 2007 from the London Hospital in Whitechapel. That's now Queen Mary College, and I've been working as a periodontist purely ever since then. Periodontology or gum disease, it's a very structured discipline these days. We have a very good international consensus on how we treat the disease. We have 4 steps of treatment that we go through once we've got a diagnosis for our patient. So how do we get a diagnosis for a patient? Well, it starts with an examination of the mouth. And principally what we do is measure the health of the gums, and I can explain what the anatomy of that and what the nuts and bolts of it are for you now. So imagine that we've got a tooth in the mouth, and what I'm going to do is draw for you a lower front tooth. So we've got the root of the tooth going down like this, and then we've got the bit that you chew and bite with, coming up something like that, okay? Now your teeth are held into the bone, so what we want is nice, thick, supporting bone holding onto that root. And actually, believe it or not, the roots of your teeth are held in with a tiny ligament that goes all the way around. So it's quite complicated under there, and it's a little bit more like your knee or your shoulder or something like that. And the whole thing is protected by gum that comes over the top, and that's the bit that you can see, okay? Now, the gum should sit very tightly around the tooth, protecting the bone. But there is a small gap of 1 or 2 millimeters that sits just underneath the gum line. And now 1 or 2 millimeters doesn't sound like much, but it's enough for bacteria from your mouth, which are the same ones that are in your gut and the rest of your body. Those bacteria can get into that pocket. And if they're not cleared away particularly easily and quickly by the patient, then what you'll find is that those bacteria can establish in your gums and they can start to attack your gums, okay? When they attack the gums, they start to go underneath. And so your pockets go from being 1 or 2 millimeters deep to 3, 4, 5, 6, 7 millimeters and onwards, okay? And there's a point at which, even when you're cleaning, you can't get down that far, okay, underneath the gums. That point is at about 5 millimeters. So when I'm measuring your gums today, the magic number to be listening for is 5. If you've got pockets of 5, 6, 7 or 8 or more, then we know that you might have a problem of some sort. What sort of problem do you get? Well, with a deep pocket, you can't clean it. So the bacteria are under there and they start to attack the body. The body has to defend you, but it causes damage to itself, and at the same time as trying to defend you, you start to lose the bone from around the tooth. So people with gum disease, they start to lose bone and eventually they start getting loose and infected teeth, okay? So people with gum disease look something like this. They tend to have bone that's going down, but the gum sits up quite high next to the tooth, leaving you with this deep pocket filled with all the wrong sorts of bacteria. So what do? We've got 4 steps of treatment that we now go through, okay? Step 1 is about controlling the risks and controlling the causes. And I sometimes call this the George Best step, which I'll explain in a moment. We have step 2, which is deep cleaning. Step 3, which is advanced treatments. And step 4, which is when our patient's had all the other steps and is healthy, and that's the maintenance phase. Okay, so we'll put maintenance here. So what's step 1? Controlling the risks. Well, the risks of gum disease are generally not cleaning your mouth well enough, not controlling the bacteria usually. So we focus on getting our patients to clean that bacteria out of their mouth as efficiently as we can. If you also have other things like diabetes that isn't well controlled, maybe smoking if you're a heavy smoker, and there's a few other things. If we need to control those, we'll try and get those controlled as well. Basically, step 1 is about stopping the things that cause the disease in the first place. I call it the George Best step because he's quite a good example of, from another part of medicine. As you know, George was an alcoholic, and they gave him a very expensive liver transplant. But unfortunately, he went back to drinking. He didn't keep up his good behaviour, and then the liver transplant failed. And it didn't matter how good the treatment was that he had, didn't matter how good those doctors were, those surgeons, because he didn't do his bit, the treatment failed. And this is the same with gum disease. If you don't get your cleaning absolutely, really pretty immaculate, then we've known really since the 60s, we've known that our treatments don't work very, very well. So once we've got step 1 sorted, we can move on to step 2. Step 2 is deep cleaning of the gums. We make the teeth numb with anaesthetic and we clean the bacteria out. And when you do that, the body will try to heal. The body heals the gum, it tightens the gum around the tooth. And the goal of that is to make the pocket shallow, so that we've had pockets of 6, 7, 8 millimeters, and we want them to reduce to less than 5 millimeters by the end of the treatment. And typically we'll review you after about 3 months. So we do the deep cleaning, then we'll review you at 3 months. For most patients, that's where the treatment finishes. For a lot of patients, actually that is good enough to stop the disease. They're doing their bit, we've done our bit, and then they have maintenance with the hygienist. In some cases though, we might need to do step 3 treatment, and this is more advanced things. We can, believe it or not, rebuild the bone around the teeth. In some cases we can put little bone grafts in, and that will help the body to regenerate bone and re-support the tooth. Sometimes, if that's not something which we think is going to work very well, we can still reduce patients' pockets if they've not healed too well by removing some of the scar tissue that's there. So as you can see, we've got various techniques that we can use. Even if the deep cleaning isn't enough, with step 3 treatment, you can actually still make further progress, and we keep those treatments up our sleeve for later. Once we're happy, that means the team is happy, the patient is happy with the level of stability that we've got from our gum disease, the patient might then go on to have step 4 treatment, which is maintenance, and almost everyone needs maintenance. This is where you see the hygienist at the practice every 3 or 4 months, and they can spot if anything's going wrong. They can encourage you and advise you with your cleaning and your hygiene, which you've got to keep at a high standard, and they can refer you back to me if there's any problems that have crept up in the years that have come in the future. So as you can see, it's very structured. We aim to take you from the point where you've got active gum disease through the various steps until you're nice and stable and your teeth are no longer in threat anymore.